a lot of times the knee, just like any other joint, will try to pick up stress. And because it doesn't have a lot of opportunity to pick up stress, remember, it's only good at one thing, it's bad at all the rest. Oftentimes the knee will get symptomatic quickly because it just doesn't have like options A to Z. It's got like option A, and that's it. And if it's trying to pick up stress in a motion it doesn't have, it feels bad quickly.
Welcome to the Exercise is Health podcast, where we're talking about exercise, health, and the interconnectedness of the two. We are your hosts, Charlie
and Julie,
and we will be coming to you every single week from our studio, Muscle Activation Schaumburg. Hey, welcome back, everybody, to the Exercise is Health podcast. We are your hosts, Charlie
and Julie,
and we're coming to you from our studio, Muscle Activation Schaumburg in Schaumburg, Illinois. Now, at Muscle Activation Schaumburg, we believe your health is your most valuable asset. Your health is one of the biggest influencers of the quality and quantity of time that you have. And while there are many aspects of health, our expertise is exercise. Exercise has been proven time and again to not only improve your health, but also increase your longevity and improve your quality of life. And today we are talking about an issue that comes up very, very frequently this time of year, and that is knee pain.
Yes, and before we jump into knee pain, if you listen to our podcast on a regular basis and you mouth that intro with Charlie, could you please record it and send it to us? Because I'm sure some of you guys do that, and I would just get a big kick out of it because I'm like doing it in my head, sitting here, and I thought, I wonder if anyone else has been loyal enough to our podcast to have like memorized that intro and like mouths it out with excitement, just like Charlie Cates does.
Well, and that being said, if you've actually memorized the intro, good for you, because I still read it off a script every time just to make sure that I got it down. So.
Yeah, but you can still be so familiar that with your lead, you know,
That's
you just
true.
kind of...
I'm sure I could do it from memory, but I choose to read it every time. So yeah, today we're talking about knee pain because one of the things that happens during the summer is, especially as people become more physically active outside, they start doing different activities, whether it's, going for walks, bike riding, things like that. All of a sudden we start hearing these reports of knee pain come up. And we want to discuss this today because knee pain in itself can be a local symptom, but the issues can actually be very widespread. The underlying contributing factors may not actually be related to the knee at all. And so we want to discuss first and foremost what the knee is, but then also expand into why the issues you may be experiencing at your knee may not actually be stemming from the knee.
First, I need to say something because, I'm thinking about it. And it's something that a lot of people don't think about, especially when it comes to orthopedic issues. And again, Charlie hit it on the head with the idea that in the summer, especially, we're here in the Chicagoland area, people start experiencing more and more knee pain. And most of the time, and I just want to say something, in Chicago, it's not like that much fun to work out outside in the winter. Mm-mm. So something that I think we all think of is oh, when I run, my knees bother me, or when I do stairs, my knees bother me, or whatever. But there has to be something related to the season, the weather. And we all have to acknowledge that, hey, we've just spent, most of October, November, December, January, February, March, April, May, however many months, mostly seated, not walking miles around your neighborhood. And so sometimes we do blame the activity. And I think we cannot dismiss the conditioning of the knee, right? It's what have you been doing for the last 7 months while it's been iced over in Siberia here, And so we will touch on that, but I wanted to bring that up right in the beginning because I think a lot of times, we're expecting a list of exercises if it hurts when you lunge, try this. If it hurts when you run, try this. But I think too, we have to acknowledge that the seasonality of it, where it's hey, we've all been seated in our sweatpants watching Netflix for the last 7 months, and now we're excited to be outside. And so now we're moving around. So I think that definitely contributes to the issue for sure.
Actually, that's such an interesting point because I remember growing up, my dad saying, you know what the number one high school sport that reports the most injuries is in the U.S.?
Volleyball?
Close.
Wait, let me guess again. Cheerleading?
Close.
Wait, it's got to be a spring sport. Baseball. Shoot, I'm guessing all of them.
Right. So you were a springboard, right? So a lot of, and actually you guessed someone that I feel like a lot of people might guess, but actually don't. Like I think a lot of people would think football, right? Because of the high contact and whatnot.
Yeah.
But actually, interesting enough, it's a sport that has zero contact. It's track and field,
What?
but specifically for girls.
Oh.
Girls because they're in high school.
Yes.
So yeah, it's really interesting. But because they go, I'm not going to classify all of them as doing this, but it appears that a lot of them maybe go through the fall and winter months relatively inactive, and then all of a sudden they go out for their spring sport. Because in high school, you may not be taking it that seriously. We were training all year round or whatever. It's not like college, right? So now they come back after being inactive, relatively speaking, for 6 months or so, and all of a sudden all these injuries start creeping up. So yeah, girls track and field is the number one sport in high school that creates injuries. Mm-hmm. Funny enough, not football, not basketball, but about as non-contact as you can possibly get. But it has the most injuries, and it's because people are coming in deconditioned. So that I feel like is just an interesting side note, but supports the point you were making of, hey, we can't discount the fact that we've been, especially in the Chicago area, relatively sedentary and cooped up for the last 9 months or so. Of all of a sudden it's like, oh yeah, it's May, it's June, I'm going to start doing walks around my neighborhood. It's like, okay, well, I don't know how big your neighborhood is, but I also don't know why your neighborhood is all of a sudden like the metric of how far you should be walking.
Yeah.
But it's an easy metric. So that's, whether that's a mile or 3 miles, it's around the neighborhood or around the block or whatever you want to call it. And now all of a sudden, like that's the benchmark of what needs to be done. And surprisingly, or rather not surprisingly, now all of a sudden all these issues start coming up.
So I hope as we get into this conversation, you realize that it's not just, your knee pain is not just focused on the movement that you do. Although we are going to talk about that and we do have to address that. But it can also be the whole situation or the environment. And I don't mean just environment, but like what your body is used to. Like what is the history of like stressors on your body? What are you used to? I know for sure in the summer, just personally, I was just telling my mother-in-law that I probably clock about 5 miles a day, in the stroller with my daughter. And I definitely don't do that in the winter. I mean, there's no possible way that I do that in the winter. I might be active, but I'm not doing that activity. So a lot of things you might notice when you are experiencing knee pain, I think the most common one we see is things like going up and down stairs. It's a pretty big knee bend, and it's a pretty unique force opportunity or a unique exercise. Like when else do you kind of do that motion except for stairs? So we see that a lot. We see a lot with lunges. And then relative to your experience, then you start labeling things. For example, last week I had a client tell me like, I can't do too much biking because, biking can be too much on your knees. So I'd rather be on the treadmill. And then the next client that comes in is like, yeah, we can't do too much treadmill because it's too rough on the knees. So it's like, it's all relative to your experience. And so that shows us that there's not just like a group of 5 exercises that you shouldn't do if your knees bother you.
I was going to say another thing that, especially this time of year, is yard work. Kind of in like a deep knee bend or squatted position, whether, it's gardening or, weeding or whatever. But all of a sudden you're doing this yard work that at least if you in the Midwest, you haven't been doing all year. And so that's a new stress for your body as well.
Yeah, and a lot of people will feel this discomfort in terms of like sharpness. It can also be a dull ache that just kind of sits there and never goes away. It can also feel like kind of like a swelling type motion, like your body is not allowing a lot of motion in the knee or just limited at the end. So it's just a little bit less. It's funny because we don't feel a stretch when we do it, but you have a little bit less flexibility, or what Charlie and I prefer to call mobility, right? The knee won't move quite as much. You might also notice that the discomfort comes along situationally, meaning, every time I do, the stairs, or I'm organizing and I'm going up to the attic 50 times a day, then my knees bother me. Or every time I do that lunge workout, my knees bother me. So your discomfort in your knees can be experienced in a lot of ways. And I hope by us starting to address it this way, The symptoms can be different. The situation can be different. The exercises that feel good and not feel good can be different. I hope this shows you that it's not just a black and white cut and dry thing, but there are a lot of principles that we're going to review that will hopefully bring some clarity to what might be going on with your knee, and maybe not so much what might be going on, because as you guys know, Charlie and I are not doctors. We cannot diagnose anything, but what you can do to start doing things to promote the health of your knee. It's kind of like us saying like, hey, I don't know like where the line of like too much body fat is, but we do know that you probably should eat fruits and vegetables and exercise regularly. You know, we're not diagnosing you with any kind of syndrome or issue in the knee, but there are principles that should be commonplace just to keep the knee joint healthy.
So let's kind of take a step back and talk about what is the knee to start, okay? And you might be thinking, okay, well, duh, I know what the knee is. But actually, a lot of people don't know what the knee is, okay? Because a lot of people confuse what's called the patellofemoral joint with the knee, and they'll call it the knee, even though what they're actually talking about is a patellofemoral joint. They're close, they're not the same, all right? So what your knee is like your thigh bone or your femur articulating or coming into contact with your shin bone or your tibia, all right? So it's your shin bone with your thigh bone, all right? Where those two come into contact, that's what's called your knee. Now, your kneecap or your patella sits on top of your thigh bone or your femur, all right, and kind of slides in a groove that's engraved in the femur, and that can also have a lot of discomfort, and that can also have some cracking, popping, Rice Krispie sounding stuff going on. But that is not the knee. That's a patellofemoral joint, which is often mistakenly called the knee, okay? But we want to clarify that because there are different forces that happen. There's different functions of each, and that's important to acknowledge if we're going to talk about, well, what are some things that we can do for it?
I would say that most people that have knee pain, knee sharpness, knee crunching, knee crack papple, what is it?
Snap, crackle, pop.
Yeah. The Rice Krispie effect in the knee, quote unquote knee, is mostly patellofemoral. The patellofemoral joint, which is your patella or your kneecap, which glides, just like Charlie said, glides along your femur, and actually kind of like the inferior aspect of your femur. So like if you're standing there, like if you touch the front of your thigh, that's like the front, but the part that's actually like facing to the floor, that's like in your knee, I guess we could say, it also kind of glides on that part as well. So the patellofemoral joint is really set up in a very interesting way. Have you ever wondered, like, why do I have this like floating little patella or kneecap? It's not something that you probably have, I don't know. Did you guys think of this before? Let me know. Have you guys ever thought that before? Because
it's not for looks.
It's not like for looking good. I mean, think about your elbow. Our elbows don't have like an elbow cap, you know, but our knees have a kneecap. And what the kneecap does is it creates the ability for the quads to extend or straighten your knee way easier. It's like, because the patella is there, it creates some distance away from the bone, which allows your quads to be able to straighten your knee with so much more efficiency than if it wasn't there. But there is a side effect of this, and I'm going to paint this picture for you, and I want you to, you know, follow along in your brain. And Charlie, if this is not good, please edit it out. Okay, you guys know when you take a rubber band in between two fingers, and then you have like an acorn in the middle, and you pull it back, and then you slingshot it towards, you know, your spouse. You know what I'm talking about? Can you envision that? Did that make sense? Right?
Perfect sense.
Perfect sense. Okay, so we got a rubber band and an acorn, right? We're gonna take this acorn and pull it back, and then we're gonna let it go, and it's gonna slingshot forward, right? So if I wanted to create tension on that acorn, I could do it in a couple ways, right? I could grab the acorn and I could pull it back, right? Or I could keep the acorn stationary and then take my two fingers and pull them forward, right? Both of those would make like that V-like position. And both of those are going to create tension on the rubber bands, which is what shoves the acorn forward, right? So what's interesting is the acorn in this situation is your kneecap or your patella. And all day long, your body is putting force through your kneecap or through the acorn. And it's doing so usually by pulling on the rubber bands. So it doesn't matter which one happened, right? Both of them are amazing slingshots. Both of them create a bunch of tension, right? Bunch of force that allow that slingshot thing to happen. The negative side effect, positive side effect of this is that we can straighten our knees really easily. And our quads are freaking strong. I don't know if you've ever sat on a knee extension machine, but your quads are really freaking strong, okay? Partially because the muscle is big and hunky. I mean, look down at your thigh. It's a chunky, big muscle. For good reasons. It's your leg. You need to be moving around. I don't know about you, but most of us weigh probably over 150 pounds. We got a lot of weight to move around. So we got muscles to support that. It's cool. The negative side effect of that is that all day long, our quads, accompanied by the tendon that attaches into your tibia, which it doesn't matter if you know the name of that thing, but whatever, are pulling on this acorn or pulling on this kneecap. And lucky for our bodies, there's no, Charlie's not on the receiving end of that where it's just going to slingshot back. It's getting shoved into the groove where it glides. It's getting shoved into that groove that we talked about that's on the femur, the thigh bone, and underneath the femur, which is like inside your knee. But when you bend, it's actually not inside your knee anymore. So what's actually another positive of this is that the kneecap doesn't routinely get dislocated. It's very weird if you come across someone that's like, yeah, I routinely dislocate my kneecap. It happens, but it's not common, right? So this like rubber band like forces pulling from both ends on that acorn is shoving this kneecap into that groove, which keeps it in place. It keeps your quads really strong, but it also can create some funky, weird forces in that groove. And that's what a lot of people struggle with in terms of knee pain, where it's not actually in their knee, but it's actually this patellofemoral joint, because the side effect of this beautiful system of being strong, of being stable, can also be being almost too much force or uneven or inappropriate force in this little groove.
So that's a patellofemoral joint. Now, the knee joint is going to be, like I said, where the femur or your thigh bone articulates or rubs against the tibia or your shin bone, okay? So where those two bones come together, that's your knee joint. Now, what the knee joint does from a motion perspective, most notably, it's going to bend and straighten, okay? So it's going to go back and it's going to go forwards. But it also does have the opportunity to do some spinning in and spinning out, where, if the foot is in the air, the tibia or your shin bone can spin in and out. If the foot is planted on the ground, we can actually see a inverse action or a reverse action where the femur spins in and out on a fixed tibia, but there is that motion, that internal and external rotation that can happen at that knee joint. Predominantly it does go front to back, but we definitely need to note that it does spin in and out as well, because that creates a different set of forces and a different series of opportunities there at that joint. What it's really not good at doing is going in and out, going side to side rather. So you know how your arm will go out to the side like you're making a snow angel and then kind of back down to your side? Your knee doesn't really create that motion. And in fact, when that motion does happen, that's often what we see ended up as an injury. Okay, so somebody has a more significant injury, we typically see that what's called a frontal plane or side-to-side motion happening at the knee when that happens. So that being said, we don't like seeing that kind of in and out motion, that side-to-side motion of the knee, but the front-to-back motion we definitely like seeing, and the spinning in and out motion, we also need to see that, because as we'll talk about, if that motion can't happen, then other areas of the body have to pick up that motion, and those areas of the body can start to get stressed.
There you have it. Knee anatomy in like 3 minutes. The knee is really fascinating to me. Well, actually, you guys already know this. Me and Charlie, I'm like, we just like love anatomy. We just love anatomy. And I think that it's so important and rarely talked about, the structure of anatomy, which is the joint we just reviewed. If you have a chance, check it out on Google or whatever, because the anatomy of of a joint tells you what it does. Whenever I talk about knees, any joint, I love to use the example of a door hinge. Like when I look at a door hinge, Charlie, when you look at a door hinge, can you pretty much tell what it's going to do before you have it do the thing it does?
Oh, for sure.
Like, what does it do?
It's going to, if it's a vertical door hinge, it's going to spin so the door goes front to back.
Mm-hmm.
If it's a door hinge where the door is, say, like a doggy door, then that door is going to spin forwards and then come backwards.
Mm-hmm.
So yeah, I mean, definitely, whatever the hinge, however the hinge is aligned, you can see exactly what's going to happen with the door.
Totally. And so just by knowing the structure of that hinge, you can already assume and know how that joint's going to move. You can do that with anything. If you had like a joystick on a remote control, mm-hmm. you can kind of know what that joystick is going to do, what motion it allows, and how it's supposed to move before it even moves. That's why we like to talk about joint anatomy, because the joints are exactly the same way. I mean, yes, there are muscles and ligaments and tendons and things like that are influencing this, but the structure of the joint is so important. That being said, did you notice that when we were talking about what the knee joint does, it does very specific things and it doesn't do very specific things. So what it's the best at and what everyone knows the knee to do is to bend and straighten, right? You can look down at your knee, it's like, oh, I can bend and straighten it, great. It does a little bit of spinning in and spinning out, and it does very minimal of kind of knocking in and knocking out. Like if you think of like knocked knees, your knee doesn't go like side to side like that. Now, that's so important to note because as we've talked about in the podcast before, every area of your body can influence other areas of your body. Okay, so when the knee is asked to do a whole bunch of front and back, usually it's pretty good at that. When the knee is asked to do too much spinning in and too much spinning out, it's not very good at that. Remember, we talked about it only has a little bit of that. And when the knee is asked to kind of go inwards and go outwards, it is terrible at that. It actually is like very prone to injury when it's doing like that, when it's done like that. Now, oftentimes we think about these when I'm saying, oh, we ask the knee to do something like this, we're thinking of like an injury, like, oh, I was a soccer player and the ball came and hit the side of my knee really hard, or, another player came and hit the side of me really hard, which is how a lot of knee injuries occur. But little do we know, these knee stressors can be coming from internal forces, from our muscles, from our other joints. So to keep it simple today, we're going to talk about two joints that influence the knee tremendously, which is the ankle and the foot and the hip. Now, I just reviewed how the knee moves really well, how it moves a little bit, and how it moves not at all. Because sometimes, and actually very often, there are muscle imbalances and like strength issues in the foot and ankle and in the hip that can require the knee to pick up more stress than it should have to. And that actually goes for anywhere across the body. Like if my hip's not working very well, it's very likely that my knee is picking up stress and my foot is picking up stress. If my foot's not feeling well, it's very likely that my hip is picking up stress, my knee is picking up stress, my trunk is picking up stress. And so we just see this across the board where it's like you have one dysfunctional area of the body and then you got a whole like, cascading effect of symptoms usually. It's not like there's another dysfunction there, but it's like a symptom. So the knee is really interesting because it does not have a million ranges of motion opportunity versus if you think about like your hip, think about all the ways you can move your hip. You can go forward, back, turn it in, turn it out to the side, into the side. You can bend it a whole, you can do all these things with your hip. Remember, your knee really is good at one thing, like really good at one thing, really bad at all the other stuff. And so whenever there's a muscle imbalance in the hip or in the foot, or muscle weakness, or just like whatever, tightness somewhere, whatever's going on there, a lot of times the knee, just like any other joint, will try to pick up stress. And because it doesn't have a lot of opportunity to pick up stress, remember, it's only good at one thing, it's bad at all the rest. Oftentimes the knee will get symptomatic quickly because it just doesn't have like options A to Z. It's got like option A, and that's it. And if it's trying to pick up stress in a motion it doesn't have, it feels bad quickly.
You are absolutely correct, Julian. One thing that we see a lot of times with this is when kind of artificial supports or braces are put on or in other areas of the body, specifically like the ankle foot area. I guess people really don't brace their hip that much, but a lot of times with really supportive shoes, orthotics, ankle braces, taping those areas, that is restricting motion at those areas. And there can be very specific and strategic reasons why it's appropriate to do that, okay? But the reality of the matter is, even if wearing orthotics or wearing an ankle brace or something like that is the best case scenario for your body at this time, it doesn't mean that there aren't other consequences and repercussions from doing that. And what we see without fail is that when one area of the body is restricted in motion, either because muscles aren't functioning well or because there's some kind of artificial or external support, then other areas of the body have to pick up more motion. Your body is going to figure out how to compensate around that brace. It's going to figure out how to compensate around those orthotics or around those really structurally supportive shoes. And one of the easiest ways, Julie, like you're saying, to get that front to back motion, if say your ankles can't move front to back or up and down, they can't dorsiflex or plantar flex because you're wearing an ankle brace or you have it taped or you have really supportive shoes or something like that, it's really easy to then get that motion at the knee. And that can be something that we see really start to stress out people's knees because their knees are now required to pick up more motion than they normally are. And in the short term, they can compensate all right for it. In the longer term, they start to develop more issues in those areas, more symptoms in those areas because they are chronically compensating around these structural and external supports.
Now, when we use external supports, just as Charlie said right in the beginning, he said, when they're used strategically, they're okay. But when we rely on them as a forever method, that's when it really becomes an issue. And that's something we want to make sure that we are being conscientious of. And if it's a forever choice that you would like to make for your body, then great, please do that. But for a lot of people, this still doesn't work because it might solve one symptom and it might create another. Just as Charlie said, we see this all the time. An external force or support, same thing, on one joint in the body creates a different situation for another joint in the body. And we have to be mindful that each joint working at its best is the best your body can be. One joint being manipulated into one position that might change a symptom somewhere else likely won't be a very good long-term fix, quote unquote, because it's really just following symptoms, because blocking motion in certain areas will never be a good solution for a long-term solution.
So right now what we're talking about is, a lot of extra support that's being provided from things outside of the body. The opposite extreme, I guess, is a total lack of support, and specifically from things inside the body, such as the muscles. So when your muscles aren't supporting your joints well, when they aren't supporting your hips well, when they aren't supporting your ankles well, muscles that support your knees may have to work overdrive because, again, your body is going to try to compensate around these areas that aren't working as well. And, we talked about really structurally supportive shoes. The opposite end of the spectrum, which is super barefoot, minimalist, really flexible shoes, can be equally as much of an issue if people's feet and ankles aren't ready to take on the load of essentially walking barefoot or with minimal support all day. So as detrimental as really supportive shoes can be, the opposite extreme can be true when the body isn't prepared for it, when your feet aren't ready for barefoot training, when your feet aren't ready for barefoot minimalist shoes. So that is something that we see as well. So the whole shoe thing is actually a really big component as far as why people may be experiencing knee issues, especially when they start to become more active in the summer, when they're starting to be on their feet more, starting to do more outdoor activities, walking, biking, things like that, if on the one hand the shoes are too supportive, or on the other hand if they're not supportive enough, that can all actually culminate in, hey, your knees taking on more stress than they're accustomed to.
So just to give a little hands-on, remember we're bringing up the feet and orthotics because we want to talk about how the ankles can have a huge influence over your knees. And I think that until you experience something that proves this to you, these are all words. So because we're not there with you, here's just a little quick demo you can do on yourself and just see what we're talking about. So Charlie and I are seated right now kind of at our podcasting station. So if you're able to take a seat, or when you roll up to a red light, don't do this on the highway. I want you just to sit there and put your hands on your knees. So they're like on the top of your thighs, but then kind of like waterfall them and go past so that you're also touching the very top of your shin bone. So the palm is still on the top of your knees, but then your fingers are like waterfalled over the edge. Does that make sense? Okay, so a lot of orthotics, what do? They give you a big arch, right? So I want you to arch your feet just like something is shoving up on your inner arch, the inside part. And do that a couple times. So arch them, and then flatten them back out and arch them. Do you notice that the bone that's underneath your fingertips is kind of moving and rotating when you do it? Do you feel that?
Mm-hmm.
It's big. It's big. Now try it the other way. So take your arch and shove it down, or take the outside of your foot and kind of flare it up. Okay? Don't lift your foot up off the ground. Just kind of flare up the outside. Do you feel it again? How the shin bone is moving a little bit less this time because there's just not as much motion, but it's definitely changing what's happening at the knee. So I did this example. Oh, let's do two more. Okay, now take your, I just get so excited about these. Okay, take your heel, make sure it doesn't leave the ground, but take everything above your heel and do like a windshield wiper motion inwards so that your toes are pointed inwards. You're like kind of like pigeon-toeing yourself. Does that make sense?
Mm-hmm.
So feel what the bones are doing. And I don't care if like, oh, the bone seems like it's turning inward. I just care that you feel like, oh, it's moving. The bone is moving, yeah? And then do it outwards. Yeah, so all four of those motions, which are very common, like external influencers from shoes, change not only your foot, it also changes your tibia, which is the bone that's the bottom half of your knee. It is part of your knee. And so this is why these areas are so closely related. And I don't want to say it's a negative thing, it's a positive thing. They just are. They're just closely related. So if you do anything to manipulate your feet, you got really strong feet, you got really weak feet, you got braced up feet, you got chronic sprained ankles, you have orthotic feet, whatever you have, it's influencing your knee, period. That's all we have to know.
All right, so we've thrown out a whole bunch of information to you. So how can you start to apply this? What can you do with it? Okay, well, first and foremost, things that you can do to get your muscles stronger, to get your muscles functioning better, to get your muscles working the way they're supposed to work, that in and of itself is going to help your knee. Okay, again, muscles are the things that are supporting your knees, that are supporting your joints, and that are helping to make sure that the passive tissues of your knees and of all your joints, but of your knees, because we're talking about knees today, that those tissues don't take on as much stress. So things like your ligaments, like your knees have so many ligaments that, are really popular, ACL, your MCL, if we're going to name all of them, your PCL, your LCL, and I'm probably missing a whole bunch, but those are the four main ones that often get talked about. But then you'll have, the cartilage of your knee, like your menisci, so your medial meniscus and your lateral meniscus, those are passive tissues. And so those are the things that people tend to, when they have structural knee issues, aside from arthritis, those are the things that often get brought up as far as what's structurally wrong with the knees. Well, your muscles are there to, yes, move your joints, but there to help protect your joints and protect all of those passive tissues. So the better your muscles work and the stronger your muscles are, the better protected all those passive tissues are going to be. So doing things to make sure that your muscles are functioning well and are staying strong, that's a really big thing. So what's one thing that you can do? Resistance training, like making sure that you are doing resistance training, lifting weights, yes, for your knees. So doing the knee straightening exercises, doing the knee bending exercises. If you want to do some knee spinning in and out exercises, that's cool too. But also making sure that you're doing exercises for your hips and for your ankles, because of how closely related those areas are. Yes, you want to be doing exercises for your whole body, but again, subject content specific for today's episode, yes, focus on the knees, but also making sure you're adding in hip exercises and also adding in ankle exercises.
Amazing. Okay, so I have a few comments to address anyone that is low-key rolling their eyes right now, okay? So if you just listen to that and you're like, yeah, Charlie, you just said how many ligaments there are. If you don't know, I have a ligament problem and a meniscus problem. I sprained it when I was in high school, and then, I have a pretty much torn meniscus, Just as Charlie said, I have to reiterate this because this is so freaking important. Your muscles, the stronger they are, the less stress these structures have to take on. So if you have perfect menisci. So if you have perfect menisci and perfect ligaments, the healthiest thing you can do for your knee is to keep the muscles that support that joint strong and healthy and functional. If you have torn menisci, all these crazy ligament issues and, bursitis issues in your knee, all these things, the healthiest thing you can do for your knee is to keep the muscles that support your knee strong, functional, and healthy. I feel like sometimes when we get diagnosed with some kind of joint-specific diagnosis, then we think that we have these special rules. Now, there are some special details that, we might need to consider, but for the principle of it is that you have to keep it as strong as possible. So don't use the diagnosis of the symptom as the reason that you don't keep those muscles strong and healthy. And yes, weight training is an amazing way and the most potent way to keep your muscle tissue healthy. Okay, low-key eye roll number 2. You're listening to this and you're like, you just told me that resistance training is a thing to keep my knees healthy, but just FYI, whenever I resistance training, it's when my knees hurt the worst. Okay, if this is you, I need you to, I know, I would love to go into all these details today, but that would make this podcast like 3, 4, 5 hours long. We don't have time for that. But please... I got things to do. Please go back to our exercise pyramid podcast. We will link it in the show notes. And it is the most amazing podcast, in my opinion, to walk you through how to do foundational style exercises. And when you listen to that one, that's what you're going to want to tune into, because so many people are doing resistance training in a way that makes them strong. But if you have any kind of issues, tweaks, you're older than 40, a lot of times these ways that you've resistance trained in the past will feel not great, makes you feel achy, makes you feel bad. And then if you have like a knee issue, makes the knees feel extra bad. So try those details out. And we would love to hear your feedback on that, because that is like our tried and true principles to really help you resistance train, especially if you have, some structural or pain issues.
Now, the second thing you can do is add in muscle activation techniques. Look, we cannot emphasize this enough, all right? Your body is going to default to using the muscles that are already working well. So it doesn't matter whether you're going downstairs, whether you're going for a walk, whether you're working out at the gym, whether you're going for a bike ride. Your body is trying to make that task as easy for itself as possible, which means it's going to default to the muscles that are already working well, because it's way harder to use the muscles that aren't working well. So it's going to start to compensate and default to the muscles that are already working well. Well, here's the thing. Over time, this can lead to greater and greater and greater compensations, and it can create this double-edged sword where the strong muscles keep getting stronger and the weak muscles just stay weak. With MAT, with muscle activation techniques, what we do is we go in and we find those weak muscles and we make them viable options. We help nudge them back to viable options for your body to utilize while you're exercising, while you're riding your bike, while you're going for your walk, while you're going up and down your stairs. So your body doesn't have to default to the muscles that it's always been using. It can go back to using the muscles that are optimal for it to use. And what this does is this helps balance the stresses not only across the muscles, but across the joints as well.
Great point, Charlie. And I think that MAT, obviously, it's half our business. So we do it all the time and we get treated with it all the time. And it's probably the most potent and beeline way to, figure out what area of your body is kind of lagging behind in terms of what might be causing another joint to have to pick up a whole bunch of stress. And as you said, not always the knee. It's not always the joint that we think is symptomatic, because it can be that joint. It also can be many other joints. So definitely, if you're interested, check out muscle activation techniques. You can find a specialist online by going to muscleactivation.com, and they are trained to do just that, find the muscles that are not doing their job.
Now, another thing that you can do, especially if you're going to work with a professional on this, is pay attention to the details of when your knee gets bothered, okay? It is incredibly helpful when a client comes in and says, hey, my knee bugs me exactly when I do this, and it lasts for this amount of time. And I notice that it is more severe when I do this and is less severe when I do that, and it doesn't hurt me at all when I do this. When you can pay attention to those details, it is so helpful for people that you're working with versus like, okay, my knee hurts and it hurts here, and that's about all I got for you. Because how your body is trying to convey that there's an issue, that's an important message. And so listening to that message and being able to convey that message to somebody you're working with, that they're going to really be very grateful for you for being able to do that for them. So if your knees are bugging you, pay attention to the details of it, because when you decide to involve a professional, being able to relay those details is super helpful.
So an example of this would be the knee extension machine. So if like the knee straightening machine, you sit on that, a lot of people will come in and be like, no, I can't do that one. That one hurts me. And I'm like, all right, well, let's try it. I just want to see, what's hurting. And sometimes we can do 30 pounds on there and there's no issue. And so they can do it. They just have to, they can't do a lot of weight on it. And that's okay, because guess what? We just found out what you can do, and then we can build on that, which is getting to our next point here. The second thing that you can do is it might be range specific. So you might notice that let's just say you do 90 degrees on the knee extension, right? You go from like bent to straight. So let's say the bottom 45 degrees, you feel fine. And then the top 45 degrees is when your knee starts getting poppy or painful or crunchy or whatever symptom you're not enjoying. Well, guess what? We just found out that you can do a lot of weight at the bottom half of the range. That gives us something, and it says, hey, and we can say from that, hey, you actually can do the knee extension. We just have to be particular with how you do it, how many reps, how much weight. Oh, another one, reps, right? Maybe you can do full range, heavy weight for 3 reps, and then, usually at 4 or 5 reps, that's when the crunchiness starts setting in. It's good information. It does not mean that you cannot do the motion. It just is telling us its current tolerance for that kind of motion with that force scenario.
So the final point that we want to bring up is when you're working through your exercise programming, progress yourself slowly. All right. Be patient with yourself. Progress yourself slowly. If it's a good day, that doesn't mean you need to go out and work out really hard. All right. Progress yourself slowly. Think about, okay, what did I do yesterday? And if you want to try to build incrementally off of that. One thing that we find that really, really sets people back is when they think they're starting to do well and they go out and they do way too much. And this can set them back physically, but it also can be a mental, emotional setback as well, because you thought you were doing really well. And the reality is your body is progressing, but it's likely progressing more slowly than your symptoms are progressing, okay? And so with that in mind, if you feel like, okay, my symptoms are getting way better, yeah, all right, still take it slowly, progress yourself slowly. Understand that this is a long-term game that you're playing. From an exercise perspective, hey, you want to be able to exercise for the rest of your life. And so doing something today that is going to be prohibitive of that's an issue. And so make sure that when you go and work out, it's something that you feel is building off of yesterday, not smashing yesterday.
So I just want to touch on kind of our takeaway action points, because we did a lot of education in the beginning of this podcast, which I hope gave you guys kind of the scope or the zoomed out view. But I always think it's so great to leave these podcasts. And we always try to put some action points in. It's like, okay, great. We just learned some stuff. I'm excited about it. What do I do? Right? So just to recap, the first thing is to make sure you're doing your resistance training. And when you're doing your resistance training, the way I like to approach it, especially if someone's got pain or symptoms or funkiness in a certain area, is keeping in mind that the best thing I can do for this joint is to keep it strong. Okay, so we have to be training the muscles. We have to be conditioning the muscles to tolerate force, because that's what life is, force. And our last point, which was to progress slowly, is try to find what you can own. And what you can own is, what can I do where I feel I can strengthen it, I don't feel symptoms, and I don't feel funky after, the day after, right after, all of the afters. Okay, you feel good. Once you can establish exactly that, whether it's 1 rep or 2 reps or no weight on the weight stack, whatever it is, you have to find what can you own and then add to it slowly. Once you know that all the afters, after you work out, the day after, the 2 days after, that you feel fine, that it doesn't bring on negative side effects. And then yes, use progression. And we like to always use the word from Tom Purvis, RTS, micro progression. So change one thing. So let's say you can do 10 reps at 30 pounds one time, one set of that. And that's all you can do right now. Great. Next time, once you know you can do that, try 11 reps. That's all you need to progress. That's all you need to do. Because remember, the health changing benefits of this is not that you're doing knee extension. It's the fact that you are building strength into your knee. And if you are doing 50 pounds at 10 reps, you are not building strength. You are probably wearing the knee down more than it needs to be. The other thing we recommended was to check out a muscle activation technique specialist. MAT specialists, depending on their level of education, are going to do one of 2 things. Number 1, they're going to identify muscles that aren't working properly and build them back up to speed. The other thing they might do, if they have a different style of training, kind of like what Charlie and I like to do, is we not only do that, but then we build the tolerance of muscles that are already working well, so that each joint, your hip, your knee, your back, your feet, can tolerate more and more and more stress as you go through your sessions. So that's a great way that MAT can really, really help you out. And the last thing that we brought up is to be mindful of the specifics. I think a lot of times we like to categorize things like, yeah, I have knee pain. And we have to remember that, hey, knee pain is not always all the same. Maybe you only get knee pain after you finish kickboxing class. Well, kickboxing class has very specific stressors on it. Or maybe you only get knee pain at the top of a range of something or at the bottom of the range of something. That is all amazing information for you to have for yourself, but especially to have if you are going to seek the advice of a professional, because professionals are kind of used to hearing this kind of stuff, and we actually gain a lot of information about your body through sharing those kinds of experiences.
So who do you know that needs to hear this episode? Who do you know that has been having some knee pain and is not really sure what to do, who to consult with, and where to go for information about it? Send this episode to them. Not that this episode is qualified as medical advice, but at least to shed some light on some different things that they may not hear from other sources and some other considerations that they can take while they are trying to figure out how to go about maybe addressing some of their knee issues. And while you're online, if you wouldn't mind, head on over to iTunes and leave us a rating and review. It helps people find this information when they are looking for podcasts on exercise and they are looking for podcasts on health. So if you found value in this conversation today, let us know by leaving us that 5-star rating and review. Well, thanks so much for tuning in. We always appreciate it. Have a fantastic week, and we'll talk with you all next week.